Welcome back to the deep dive. A lot of you have shared info about chiropractic care, and one clinic in particular, ACuSTAR Wellness in Bangalore, keeps popping up.
Yeah, we've seen those comments and emails.
So today we're diving deep, our mission, to really unpack what chiropractic is, but specifically how ACuSTAR Wellness presents it based on the FAQs and info you guys sent us.
Exactly. We've got their website material, mainly FAQs. We'll try to pull out the key stuff, answer those common questions. What is it? What's the cost? Does it actually work according to them?
Perfect. Because, let's face it, lots of questions float around about this stuff. So let's start right at the beginning. According to ACuSTAR Wellness, what is a chiropractor?
Okay, good place to start. So they define a chiropractor as a healthcare professional focusing on the musculoskeletal system.
Meaning bones, muscles, nerves, that sort of thing.
Pretty much orthopedic and neurological stuff, they say, especially the spine. And what's really front and center is their emphasis on natural, hands-on treatment.
Ah, right. No surgery, no drugs.
Exactly, they state that clearly. That seems to be a big part of their philosophy, which probably appeals to quite a few people looking for alternatives.
Makes sense. And looking at ACuSTAR specifically, they mentioned Dr. Rudresh.
Yeah, they highlight him. European certified, 25 years of experience, and not just chiropractic. They list osteopathy, allopathy, even acupuncture. It's quite a mix.
Interesting background. So qualification-wise, they're not medical doctors like MBBS, right?
Correct. ACuSTAR clarifies that. They say chiropractors aren't MBBS doctors, but they do have specialized training. Something about studying 32 subjects focused on spine, nerves, muscles.
So a very specific, deep training in that area.
That's the idea they convey, yeah. Focused on musculoskeletal health.
Okay, so that gives us a picture of who they are. Now let's get into the what. If you go to ACuSTAR Wellness, what do they actually do? What services are on offer?
Well, based on their FAQs, it seems pretty comprehensive. They kick things off with detailed ortho and neuro exams.
Makes sense. Gotta figure out the problem first.
Right. Then they mention osteopathy correction of the pelvis, which I guess relates to getting your pelvic alignment right for overall spine health.
Okay. Pelvic alignment and then spinal adjustments.
Yes, they call it soft chiropractic for spinal adjustments. Sounds like it'd be a gentler technique.
Could be. What else?
They list treating a whole range of musculoskeletal conditions. It's broad. Plus, specific posture correction, they mentioned scoliosis and kyphosis.
Oh, interesting. So adjusting structural posture issues without surgery.
That seems to be the focus there. And they also talk about preventive care, giving advice on how to sit properly, sleeping posture, trying to stop problems before they start.
I like that proactive bit. Is it sort of a standard treatment for everyone, or?
No, definitely not. They explicitly say they create personalized plans based on your age and your specific condition. They also cover managing chronic pain, back, neck, knee pain, even migraines are listed.
Wow, migraines too.
Yeah. And they perform assessments of joints, spine, discs, nerves, plus the actual adjustments and manipulations. They also mention arthritis and knee pain management specifically, and even general wellness guidance.
It's quite a lot. Anything stand out as particularly unique?
Well, the sheer range is one thing.
Yeah.
Also, they mentioned doing advanced diagnostics without MRI or CT scans. That's interesting. Might be worth asking how they do that if you're thinking of going.
Good point. Okay, so we know what they do. What specific conditions do they claim chiropractic therapy helps with? What's on their list?
It's a pretty long list, and it mirrors the services. Back and neck pain, obviously, that's probably the first thing people think of.
Sure.
Sciatica is high up there too. Spondylitis, knee pain, scoliosis, ties back to the posture stuff.
What about just general stiffness? I saw that mentioned.
Yeah, body stiffness. It's vague, but
Yeah.
lots of people feel that, right? Could be related to alignment or movement issues they aim to fix. They also list hip pain, headaches.
Headaches again, interesting link.
And sports injuries are on there too. Plus, just generally posture-related problems.
Okay, quite the range. Now, big questions. Is it safe? Is it effective? What's ACuSTAR's stance on that?
They tackle this head-on. They say, yes, chiropractic adjustments are safe, but the key is having them done by qualified professionals, like Dr. Rudresh.
They emphasize his qualifications and experience there.
Absolutely. They mention the thorough assessments, the 25 years of experience using proven techniques, and they bring up that soft chiropractic again, plus techniques from Europe's Ackerman College, highlighting its safety protocols.
That connection to a European college probably adds some weight for people.
It could, yeah. And they claim patients see significant improvement in things like back pain, neck pain, sciatica. They even mention thousands of scientific studies and clinical trials backing chiropractic's effectiveness.
Okay, that's a bold claim. Of course, anyone interested should probably look into that research themselves.
Always a good idea. Do your own homework. But they do provide a number from their own clinic, an 85% patient satisfaction rate.
85%, that's quite specific. Hearing about other patients' experiences can be persuasive.
It often is, yeah.
Okay. Let's shift gears to something very practical. Money. Cost. What are we talking about for ACuSTAR Wellness?
They seem pretty upfront about it. The initial consultation, which includes the ortho exam with Dr. Rudresh, is 900 rupees.
Yeah, what does that get you?
According to them, it covers a full ortho evaluation, the chiropractic diagnosis, and then they recommend a personalized treatment plan. They actually emphasize that they believe in transparent pricing and discussing costs up front.
That's good. Transparency is key. What about follow-up treatments?
Regular sessions, they say, range from $1,500 to $2,500 per session.
Okay, there's a range there. Depends on...
Yeah, depends on the complexity of the treatment needed for your specific case. They also mention customized treatment packages.
Ah, like package deals.
Exactly. For multiple sessions, like if you sign up for, say, 12 sessions at once.
Yeah.
Might make longer-term care a bit more affordable for some people.
Right, options are good. Now, their FAQs dig into some really common pain points. Let's talk about back pain, specifically in women. What do they say causes it, and how do they approach it?
They list quite a few potential factors for women. Poor posture, obviously, but also hormonal changes, pregnancy, maybe being too sedentary, lifting things wrong, even things related to the menstrual cycle, workplace setup, weight stress, muscle imbalances.
So a lot of potential triggers.
Yeah. And they say their treatments and personalized plans are designed to target these specific underlying causes.
And what about just general back pain relief? Any immediate tips or longer-term strategies they suggest?
Yeah, for anyone. They recommend, first off, chiropractic adjustments, but also focusing on proper posture, doing specific stretches, making sure your workspace is set up, right ergonomics, and general lifestyle changes.
What about when it really hurts, like right now?
For flare-ups, they suggest the basics: ice or heat, gentle stretching, and making sure you rest properly.
Okay. Sciatica, that sounds awful. How do they explain that? What's a plan for it?
They describe it pretty clearly. Nerve pain starting in the lower back, shooting down through the hips into the legs. It's because the sciatic nerve is getting compressed somewhere.
And it feels like...
Sharp pain, shooting, maybe burning, tingling. Not pleasant. Their approach for, they say, permanent relief involves adjustments to fix the compression, exercises to strengthen muscles, posture correction, and lifestyle advice to hopefully stop it coming back.
Makes sense. Let's move up to the neck. Neck pain is so common now, right? Phones, computers.
Tell me about it. They point to exactly that. Poor posture with devices, stress, sleeping funny, maybe underlying spine issues.
And for quick relief?
They suggest an adjustment, gentle stretches, getting the right pillow, fixing your posture, reducing stress. But for lasting results, they talk about specific cervical adjustments for the neck, techniques to release tight muscles, ergonomic advice, exercises, and lifestyle changes again.
It seems like adjustments, exercises, and lifestyle are recurring themes.
Definitely. It's a holistic approach they seem to push.
What about spondylitis? That sounds more serious.
It can be. They explain it as inflammation in the spine's vertebrae, leading to stiffness. Ankylosing spondylitis is a chronic type, often starting in the lower back. They say they offer specialized care and have managed these conditions successfully using chiropractic, exercise, posture work, and lifestyle advice.
Okay. And one more knee pain, but not from an injury. What causes that, according to them?
Could be posture again, muscle imbalances around the knee, overuse, just age, lifestyle factors, a few things.
And their solution?
Both quick relief, like adjustments, and the RICE method,
Right.
rest, ice, compression, elevation, and longer-term plans involving exercises to strengthen the knee area, balance training, and again, lifestyle tweaks to reduce strain.
Got it. Okay, we've covered a lot on conditions. Let's zoom back out to ACuSTAR Wellness itself. Any other key details from their FAQs we should mention?
Well, they reiterate the credentials: Europe certified, licensed, 25 years experience across chiropractic, osteopathy, allopathy, acupuncture cupping. They also mention experience in U.S. hospitals.
That might give some people confidence in their standards.
Possibly. And importantly, for local context, Dr. Rudresh is KPME registered and KSDC licensed. So they meet the local regulations there in Karnataka.
Good to know. What about treatment duration? How many sessions are we talking?
They're clear it varies. Depends on if the problem is acute, subacute, or chronic, and what the initial evaluation shows.
So no magic number.
No. They do say you might feel some relief after the first session, but a full course could be anywhere from a few sessions to, say, more than 12, depending on how complex things are.
Okay, manages expectations, and practically speaking, getting an appointment hours.
Your hours look pretty convenient, actually. 8 a.m. to 10 p.m. weekdays, slightly different on weekends, but, and this is important, it's by appointment only. You can't just walk in.
Right, you need to call or email first.
Exactly. And they provide all that contact info, phone, email, and the addresses for their 2 Bangalore locations very clearly on their site.
Makes it easy to follow up. Okay, so as we wrap up this deep dive, what are the main takeaways about chiropractic care as ACuSTAR Wellness presents it?
I think the core thing is that they position chiropractic as this specialized healthcare field for the musculoskeletal system, especially the spine. It's non-surgical, medication-free, treating a really wide range of issues.
From aches and pains to more chronic stuff.
Exactly. They emphasize a holistic, personalized approach, Dr. Rudresh's extensive experience and credentials, and they strongly state that their methods are both safe and effective, citing high patient satisfaction.
And of course, we always have to say, if anything we discussed today strikes a chord with your own health situation, the best bet is always to talk to a qualified professional yourself. Get that personalized advice.
Absolutely critical. You know, thinking about everything ACuSTAR covers, all those pain points like back pain, sciatica, neck issues, the costs, their specific approach. What particular part of it maybe caught your attention the most? Was it a condition they treat that sounds familiar? Or maybe their focus on non-surgical care? Because that specific point of interest for you, well, that could be a great place to start your own digging. Or maybe even prompts you to consider reaching out for consultation to see if it fits your needs.
That's a really good final thought, something to mull over. So, if this deep dive has piqued your interest, definitely check out the ACuSTAR Wellness website or get in touch with them directly. The info seems readily available.
Yeah, they seem quite open with details.
Thanks for joining us for this deep dive, everyone.